Hello, everyone. Have you ever thought that walking, an activity that seems simple and good for health, could actually be harmful to some elderly people? Yes, while walking is a great way to maintain health, for individuals with specific health issues, walking too much can sometimes bring unexpected risks. In today's video, we will explore the 5 groups of elderly people who need to limit walking to protect their long-term health. From those with blood pressure or heart problems to those recovering from surgery or facing joint issues. This video will offer useful advice to help you and your loved ones stay healthy every day. If you find this information helpful, don't forget to leave a comment below and hit the subscribe button to always stay updated with useful health knowledge for seniors. Let's get started. Walking, an activity that seems simple and beneficial, can become a risk for some elderly individuals, especially those facing specific health issues. While regular exercise is key to maintaining health, excessive walking can exacerbate underlying conditions and increase the risk of injury. For seniors, balancing physical activity with rest is crucial to ensuring safety and long-term health. 5 groups of elderly individuals need to be particularly cautious when walking to avoid health risks. Firstly, people with unstable blood pressure should limit their walking, as excessive activity can lead to dizziness, fainting, or an increased risk of stroke. Secondly, those with chronic heart disease should also avoid overexertion, as it can strain the heart and cause chest pain or difficulty breathing. Third, individuals recovering from surgery or injury need to refrain from walking too soon, as it could slow down the healing process. Fourth, those with severe peripheral neuropathy are at higher risk of falls due to numbness and loss of sensation in their legs. And lastly, people with severe arthritis should be cautious, as too much walking can worsen joint pain and cause further damage. To help understand the specific risks and precautions for each group, let's take a closer look at each one. People with unstable blood pressure. As mentioned, excessive walking can pose serious health risks, especially for elderly individuals with unstable blood pressure. For this group, maintaining stable blood pressure is critical, but overexertion during walking can lead to unpredictable consequences. Those with orthostatic hypotension may experience a sudden drop in blood pressure when standing or walking, causing dizziness, lightheadedness, or even fainting. On the other hand, individuals with uncontrolled high blood pressure face an increased risk of stroke or cardiovascular complications when engaging in strenuous activity. One of the biggest dangers is that these symptoms often occur unexpectedly. A person may feel fine when they start walking, but after just a few minutes, they could experience blurred vision, muscle weakness, or the feeling of fainting. Without support, or if they're in a public space, this can lead to falls, head injuries, or other serious accidents. It's important to note that many individuals may not realize they have blood pressure issues until a dangerous incident occurs. For example, an 82-year-old woman once fainted while walking due to a sudden drop in her blood pressure, resulting in a broken wrist. After consulting with her doctor, she adjusted her walking routine, stayed hydrated, and used assistive devices for added safety. To prevent risks, elderly individuals with unstable blood pressure should stay hydrated, walk with support, such as a cane or a companion, and check their blood pressure regularly. Additionally, switching to gentler exercises like leg stretches, balance exercises, or seated workouts may be a safer alternative. Most importantly, it's crucial to listen to the body and not push beyond personal limits. If you or a loved one belongs to this group, feel free to share your experiences in the comments below. People with chronic heart disease. Next, let's explore the group of elderly individuals with chronic heart disease, one of the groups that need to be especially cautious when walking. For many people, walking is an excellent way to boost heart health, but for those living with cardiovascular conditions such as heart failure, arrhythmias, or unstable angina, excessive walking can become a real danger. When walking, the heart has to work harder to pump blood throughout the body. For those with a weakened heart, this can lead to overexertion, causing symptoms like chest pain, shortness of breath, extreme fatigue, or even severe events such as heart attacks or strokes. Even more concerning, these symptoms often appear suddenly, leaving the person unable to react in time. Someone may feel fine when they start walking, but just a few minutes in, they could experience chest pain or irregular heartbeats. A typical example is a 79-year-old man with a mild heart condition. Although his doctor advised him to walk gently, he pushed himself to walk longer distances, thinking it would improve his health. As a result, he had to be rushed to the hospital due to severe chest pain and difficulty breathing. Afterward, his doctor recommended he stick to a lighter exercise plan, combining it with strength-building exercises under close supervision. To ensure safety, elderly individuals with chronic heart disease should strictly follow their doctor's guidelines on the intensity and duration of walking. They should also listen to their bodies. If they experience chest pain, shortness of breath, or unusual fatigue, they must stop immediately and rest. Additionally, incorporating gentler exercises like yoga, tai chi, or deep breathing exercises can help improve cardiovascular health without putting too much strain on the body. People recovering from surgery or injury. Next, we'll discuss elderly individuals who are in the recovery phase after surgery or injury, a group that requires extra attention when walking. During this phase, gentle movement is necessary to stimulate circulation and prevent joint stiffness, but walking too early or too much can have the opposite effect, slowing recovery and even causing new injuries. After surgery or injury, the body needs time to heal tissues, muscles, and bones. Overexertion from walking can put pressure on the affected area, leading to swelling, inflammation, or re-injury. Particularly for those who have undergone joint replacement surgeries, such as hip or knee replacements, excessive walking can weaken the surrounding muscles, making the joint unstable and increasing the risk of falling. A typical case is that of a 75-year-old woman who had knee replacement surgery. Although her doctor advised gentle walking with gradual intensity increases, she pushed herself to walk more, hoping to return to normal life quickly. The result was severe pain, swelling, and several extra weeks needed for recovery. After following her doctor's instructions and adjusting her exercise routine, she gradually regained her health and mobility. To avoid these risks, elderly individuals recovering from surgery or injury must strictly adhere to their doctor's or physical therapist's guidelines. It's crucial to listen to their bodies. If they feel pain, fatigue, or swelling, they should immediately reduce the intensity of their movements. Instead of long walks, they can start with gentle exercises like leg stretches, leg raises, or balance exercises to strengthen muscles without putting pressure on the injured area. People with severe peripheral neuropathy. Let's explore the elderly group suffering from severe peripheral neuropathy, a particular health condition that requires extra caution when walking. Peripheral neuropathy, often seen in people with long-term diabetes or neurological issues, causes numbness, muscle weakness, and loss of sensation in the feet and lower legs. This not only makes walking difficult, but also significantly increases the risk of falls and serious injuries. One of the biggest dangers of peripheral neuropathy is that patients often cannot feel injuries to their feet due to the loss of sensation. For example, they might not notice blisters, wounds, or even minor fractures when walking too much. If left undetected and untreated, these injuries can lead to infections, foot ulcers, or in severe cases, amputations. A typical case involves a 78-year-old man with diabetes and peripheral neuropathy. He regularly walked around the neighborhood, but didn't realize he had developed a large blister on his foot due to ill-fitting shoes. The wound quickly became severe and led to an infection, requiring him to be hospitalized for several weeks. Later, his doctor advised him to wear special supportive shoes, check his feet daily, and limit long walks. To ensure safety, elderly individuals with severe peripheral neuropathy should take several preventive measures. First, they should wear well-fitting, supportive shoes with padding to reduce pressure on the feet. Second, checking their feet daily is crucial for early detection of wounds or abnormalities. Finally, instead of long walks, they can switch to gentler exercises such as swimming, stationary cycling, or seated workouts to maintain movement without risking harm. People with severe arthritis. Finally, let's explore the elderly group suffering from severe arthritis, a common condition that requires special attention when walking. Arthritis, particularly osteoarthritis or rheumatoid arthritis, causes pain, joint stiffness, and swelling, especially in weight-bearing joints such as the knees, hips, and ankles. For those with severe arthritis, walking too much can increase pressure on the already damaged joints, leading to even more intense pain and potentially accelerating joint degeneration. One common mistake among those with arthritis is attempting to walk more in hopes of relieving stiffness and improving mobility. However, when the joint cartilage has worn down, excessive walking can cause the bone ends to rub against each other, resulting in pain and worsening inflammation. This not only impacts the quality of life, but can also lead to complications such as joint deformities or loss of mobility. A typical case is that of an 81-year-old man with severe knee arthritis. He frequently walked to reduce joint stiffness, but the more he walked, the more intense his pain became. Upon examination, the doctor found that excessive walking had increased the pressure on his knee joint, worsening his inflammation. Instead of walking, he was advised to switch to gentler exercises such as swimming and stationary cycling, which help improve blood circulation and strengthen muscles without putting pressure on the joints. To protect joint health, elderly individuals with severe arthritis should listen to their bodies and adjust their activity routines accordingly. Instead of long walks, they can try gentler activities like swimming, water aerobics, or seated exercises. Additionally, using supportive devices such as walking canes or knee braces can help reduce pressure on the damaged joints. Although walking is a beneficial physical activity for health, not everyone can apply the same intensity or duration. For the elderly, it's crucial to listen to your body. If you feel pain, fatigue, or discomfort while walking, it may be a sign that you need to adjust your exercise routine. To ensure safety, it's best to consult with your doctor or a physical therapist to create a workout plan suited to your health condition. Don't push yourself beyond your limits, as this could lead to serious consequences. If walking causes pain or discomfort, consider switching to gentler activities such as swimming, yoga, or seated exercises. These activities still allow you to stay active without putting excessive pressure on your body. Through the information shared in this video, we can see that adjusting physical activity according to one's health condition is incredibly important for the elderly. Walking, although a simple and beneficial activity, may not always be suitable for everyone, especially those dealing with issues like unstable blood pressure, chronic heart disease, severe arthritis, or recovery after surgery. Listening to your body and following the guidance of doctors or physical therapists will help you avoid unnecessary risks while maintaining sustainable health. Don't hesitate to change your exercise habits if walking causes pain or discomfort. Gentler exercises like swimming, yoga, or seated exercises can be excellent alternatives to keep you active without putting stress on your body. Sharing experiences and listening to expert advice are key to living a healthy and independent life. Everyone has different physical conditions and needs, so finding the right exercise method for yourself is essential. At Senior Sparks Channel, we value and appreciate your feedback. Please leave a comment below to share your thoughts or experiences. If you found this content helpful, don't forget to hit like and subscribe to the channel if you're new, so you'll always be the first to receive useful videos from Senior Sparks Channel. Thank you for allowing us to accompany you on this journey.